Welcome, everyone, to the Slice is Right podcast, episode number 7 in beautiful, sunny, and hot Scottsdale, the home of the Arizona State University Sun Devils.
Welcome, everybody. Hello, Dr. Ogley here. Thank you for joining us.
That little statement had an asterisk because, they're really in Tempe, but hey, close enough.
They're close enough. And I'm a U of A person, so we'll forget it.
Yeah, I think I hurt his feelings a little bit.
No, it's okay.
You okay?
I'm fine. I'll get over it.
He's all right. He's tough. He's tough. Today's topic is Mommy Makeover.
Yes, one of our favorites here.
Let's see, Scott, can you define for us what Mommy Makeover means?
Well, Mommy Makeover, I don't know if there's one singular definition of what it is, but at the very least, it is usually an abdominal and a breast procedure. So classically going to be a tummy tuck, liposuction of the flanks, back, and bra line, and that's usually paired with some sort of breast surgery like a breast augmentation and a lift, or anything in between.
Yeah, no, I think it's a marketing, right? I mean, the plastic surgeon probably didn't come up with that. Somebody in marketing did, and it's like a cute name for combining everything that needs to be fixed in a woman that's had babies, right? A mom, they've had babies, the breasts get a little ruined, the tummy gets a little ruined, right, by having babies. They're worth it, though, from what I hear. And what we do, we specialize in mommy makeovers, and we love getting moms back into the body they had in their 20s.
It's our favorite thing to do here.
Yeah. So you mentioned a little bit about some of the combinations that are out there, right?
Yeah.
So we made a little list. We thought about some of the options. So option number 1 would be a tummy tuck and a breast dog. Let's tell us about option number 2 here that we wrote.
Yeah, tummy tuck and a breast lift with implant. So that's a breast augmentation in an otherwise patient that has a little too much saggy skin on the breast and needs to tighten the breast as well.
Right, and right now we're offering basically 2 types of breast lift. I offered a third one, right? So anchor pattern's pretty classic. That's the most powerful, most effective, most common. I think it's the most effective breast lift for the average woman. And then we do a vertical lift in some people, right?
And just the right patient, yeah.
Yeah, and I think one thing to note is like when you have a saggy breast that is long but also wide, the anchor pattern is going to apply much, much better. And it's also typically applied to very, very saggy breast. And then when you're sort of middle of the road in terms of your sagginess and you're not that wide, you can get a vertical lift.
Yes, just
shorter
for
scar.
those patients that are kind of on the cusp of a lift and no lift. The same with a peri-areolar lift or a donut lift.
Yeah, also, just so you guys know out there, the vertical lift has a cute name too that probably was invented by a marketing guy as well, and it's called the lollipop because, from far away, the incision's a little vertical line with a little round areola at the top, so a lot of people say, hey, that looks like the lollipop.
The lollipop, exactly.
Yeah. So we got a boat anchor lift, you got a lollipop. What else have you seen me do around here?
Well, we also do breast reduction. Sometimes breasts are too saggy and too large rather than saggy and small. So we can do breast reductions as well as any of these surgeries without implants. Implants are not required. They're often necessary to get patients where they're going to be happy, but they're not a requirement.
That's a good point. So at home, if you're trying to figure out, well, am I going to need an implant? Am I going to be happy with an implant or without an implant? One of the things you should know is that implants will increase the size of your breast or maintain it, okay? So if you have a breast size that you're happy with and you know that you're going to go to see a doctor about getting a breast lift, you should probably count on the fact that they're going to be smaller after the lift. So if you think, I'm a C and I'm going to become a B cup because of the lift, you might not be happy. Probably think about implants. Now, if your breasts are soft and mushy because of childbirth, you can definitely also add an implant for perkiness.
Yep.
Yeah.
Upper pull fullness is what I think a lot of patients hope to get after just a standard lift. And the reality is lifts without implants tend to not really contribute much fullness to the top of the breast. And they look more natural. He's
got an excellent point. The part that people really miss after having babies is that extra fullness at the top of their breast.
Top of the breast. That's
implants
where
are really great at restoring that.
And almost the only thing, really.
Yeah, it really is the only thing. And I think I know what you're kind of insinuating there. You're saying maybe fat grafting.
Fat grafting does have a small role in that. It's not going to be the end all for patients that are looking for a significant amount of change. But if somebody's looking for a very small, modest half cup size improvement, and then wants to look on the very natural side, fat grafting can have a role for sure.
Right. Yeah. Let's get a little bit into the weeds with, breast implant versus fat grafting. So, so let's just say you're sitting there making decisions for this patient's case. you need to increase the breast size, let's say by 2 cups.
Yeah.
Breast implant or fat grafting?
Well, there's really no way you can do that with fat grafting, so the only option is a breast implant.
How about 1 cup, breast implant or fat grafting?
That's sort of where the cusp, the cusp between the two. I think a cup is still asking a lot of fat grafting. High volumes of fat grafting can have their own set of issues, including a lot of death of the fat and causing a lot of cysts and scarring. So if patients are okay with half a cup size, I think fat grafting is a great role. 1 cup size, 2 beyond, that's really implant territory in my opinion.
Right, absolutely. A nice full upper pole that looks augmented, implant versus fat grafting.
Augmented look, that's an implant.
I think that was a pretty easy one, but you want the augmented look, you're going to need an implant to augment it. Fat grafting is just not going to do it. And he also mentioned a little bit about some of the complications of fat grafting. And I'm always surprised how little patients know about the complications of fat grafting. Most of them are pretty mild, but they tend to affect your mammogram very much. You can get calcifications, you can get oil cysts, and you can get fatty necrosis, which can feel like lumps, and sometimes that scares people when they get a lump in their breast after surgery. So I think we can avoid all of those with implants, so we rely on implants most of the time. And yes, I typically will use the fat just to kind of contour and highlight some of the shadows and curves of a breast.
Yeah, it's a good adjunct. It's not an end-all for a breast enhancement with the fat grafting, but it can really enhance a breast implant result too, with better upper fullness, with a little bit better cleavage lines, especially with under the muscle implants that sometimes can lack a little bit more central fullness.
Right, and also, we offer fat grafting to all of our breast lift patients. The most popular fat grafting episodes that we do is probably when we're removing implants or getting a lift and they're getting a little fat grafting to keep some of the volume. But also we do it with implants as well to get a little bit better cleavage, because the fat can be injected above the muscle, and most of our implants are placed below the muscle to reduce the risk of capsular contracture. Let's talk a little bit about the breast lift with no implants versus the breast reduction. What's the big difference, or what's the difference there? Scott, tell the public out there.
Well, they're both, between a breast lift and a breast reduction, they're first and foremost lifting the breast, but the breast reduction is removing excess tissue. A breast lift is trying to maintain as much tissue as we can because you are otherwise happy with your size and just wish that you looked a little more lifted.
Right. He's totally right. This is Scottsdale. People want nice, full, round breasts. So in my practice, the most common breast reduction is a cosmetic breast reduction where I'm taking a very small amount of breast tissue and primarily doing a lift with no implants.
Yep.
And at the same time, maybe reducing one size because it's bigger. So it's really a breast reduction for symmetry. Let's say the patient comes in with a double D and we lift him and there's still a double D, or a D and there's still a D, or a C. We don't really do those larger breast reductions on a routine basis in Scottsdale, but we do get some patients.
Yeah, absolutely.
We've taken patients from as large as double D down to a B cup, and very successfully so. But the difference is volume. That's the bottom line. The weight of the tissue that we're removing. In a breast reduction, it can be a lot. In a breast lift, typically it's a very small amount. And
true.
What's the most common incision that we use for both of those around here? What do you think?
Well, the full anchor scar is, especially for breast reductions, is really the only way to take out the excess tissue that is both in the horizontal and vertical dimension. So any other way is really not going to adequately address the extra skin.
Right, and the best words that a woman can hear who's saggy, who needs a breast lift, is that the breast lift is the best operation for them.
Yeah.
Yes, we're all concerned about the scarring, and they're very fearful of the scars. However, there's excellent scar therapy these days, and the scar therapy can make a significant portion of the scar fade away. And what you get is a better breast shape. You get a beautiful round breast with good upper pole. And I think, look at our before and afters on our website. Don't be afraid. It's a journey that we're going to be with you together to make sure that you get the best outcome, particularly with the scarring, because, that what's on the outside is how people judge their plastic surgeon. We're going to do a really great job on that, even though all the other steps of the operation we're going to keep you safe on. Scott, let's move on to breast implant exchanges with a tummy tuck. How often do we do that?
Very often, too. It's we put a lot of implants in, and we also see patients that already have implants and want an exchange. Implants are not lifetime devices. We all know that. So exchanges are needed. They're very common, often upsizing, sometimes downsizing. We do both.
Yeah, we looked at the data. The average patient's coming in here at about 11 years after their augmentation. Some patients 20 years, some patients less than that. Yep. But we do exchange implants. Typically, I would say 90% of the cases we go up in size. 10% of the cases we go a little smaller of a device. Yep. And that's because the body changes, and also the aesthetics, what people like changes as well over the years. One thing about an exchange with upsizing while you're getting a tummy tuck is that your body gets thinner, skinnier, cuter, hourglass shape. Makes the breast look even bigger at the end. Yeah, so
and you go up in size a little bit, and you got a good rebalancing.
It's a good combination. Another little bonus that patients who are having exchanges get is it doesn't hurt as much as the first surgery.
No, not nearly.
Yeah, so I usually will quote a 50% reduction in the pain. The pocket's already there. Yeah, the implant's a little fuller, but we're only going to increase the pocket size about 20%. So the pain is, 5 out of 10 instead of a 10 out of 10 with the original surgery, and it goes away much faster. Yeah. Now, what about doing a breast lift with an exchange? You like doing those?
Yeah, they're very common too. It's just like patients that might not have a lot of excess skin after they need an exchange. Some women, have had 3 kids since their last breast surgery. They've had weight gain and weight loss, and they don't just need a simple exchange. They need a lift on top of it. Right.
That's another operation where having an implant already in place is advantageous. Typically what we'll see is that the implant is still holding its place. It's still nice and high on the chest. You can still have the upper pull fullness in some clothes and the bikini. But once that's removed, the tissue, the breast itself, the ligaments that hold the skin have given way and they drop. So there's sort of a disconnect. There's a lower natural breast and a higher implant breast. And so with the implant exchange, we can keep that same pocket, very little pain there. And then breast lift traditionally aren't painful surgeries, and you can have a good lift, reposition the nipple where it needs to be, make the whole mound one solid structure that looks beautiful, has great projection, and a wonderful round shape.
Indeed.
Yeah. Lastly, we've saved the best for last, right? We made this category of Mommy Makeover. It's the tummy tuck with the BBL.
Mm-hmm. Brazilian butt lift.
We both like doing that case, right?
Yeah, it's great. Sometimes it feels wrong to just throw all the fat away that you take out of somebody. It feels like it's wasting it, especially when you could repurpose it and use it for something that's going to really give the patient a better shape, a little bit more full, and projecting behind. So I think it's a really great adjunct to any tummy tuck. We get fat anyway with every liposuction case we do. Why not use it?
Right. So there's a lot of fat in the abdominal area, and typically I'll do the liposuction there and turn the patient over, do the liposuction of the back and waistline, and then inject it all into the buttocks and finish up at the very end by flipping them over one more time under anesthesia and getting that tummy tuck done. That's how I typically will do it. And you sort of get the best of both worlds. So you're transferring the volume that's in the front and you're putting it in the, in your backside where it just looks much better.
Just rebalancing.
Yeah. Rebalancing the body. A lot of patients achieve the type of shape that they never even had, because, when they had a thin abdomen, they didn't have a big buttock at all. And now you can really balance that situation. Yep. It's a safe surgery. The way that we do BBL is we always inject above the muscle. That's the number one way to keep it safe. Number two, we use a 4mm cannula because 4mm cannulas don't bend.
Yes, more safe.
We do have an ultrasound machine. We can check the location of the fat to make sure we're above the fascia the entire time. And then we do have a volume suggestion. Probably about 1,000 to 1,200 is safe. Surgeons can get lost in the anatomy when there's a lot more fat than that. Won't you agree with that, Scott?
I think there's just good evidence that higher volumes have a higher likelihood of causing problems. So not only just with fat embolism and dangerous things, but higher risk of necrosis of the fat, just like we talked about with breast fat grafting. It's no different in the butt. The same issues can result and crop up, so we want to make sure we're doing it effectively and safely.
So let's look at a before and after so everybody can get at home a little taste of what we're talking about. This one's from our website, myfaceandbody.com. You guys can look it up. And here's her before and after. So I would say this is the average Mommy Makeover case where you have a rectus diastasis, you have excess skin, you have unwanted fat. The patient has lost some of the definition in her waistline as well. And on the breast, she's a level 2 saggy with lack of volume, definition, lack of cleavage, some of the options we would discuss for her. What do you think you would talk to her about implants? What different options of implants?
Certainly, I think the patient would need an implant in general, given her deflation, especially in the upper pole. Type of implant, certainly a gummy bear implant of some kind. We use two major manufacturers of implants here at this practice, both Mentor and Allergan. They both are great implants. They both work well for patients. And it's just a matter of finding the proper profile that's going to fit her, the width of her breast, and also her goals for volume increase.
Yeah, absolutely. Size is going to be important. The measurements that we do on the patient are going to be critical. We want to match those measurements to what the implant brings in terms of characteristics, like projection and width and height. And then we can do the surgery, for that.
Yeah, this is a great result too, Dr. Guerra. This, nice
Thank
perky
you.
breasts, areolas facing straight ahead and not pointing downward, with a nice any belly button, a flatter abdomen, and better curve in her flanks. Looks great.
Yeah, the thing I'm most proud of on that case is the belly button, because I call it the beach-ready belly button, right?
Yeah.
6 weeks after surgery, you can go to the beach, two-piece bikini, and nobody will know you've had a tummy tuck.
Exactly. That's the
that
goal.
scar's hidden inside very nicely. All right, so we're here to the last little bit. Announcements. Your patient won 2 months in a row. His patient has won.
Okay.
His patients are really, really good at sending those pics, and they look amazing. So, what's the? Tell us a little bit about the May Guerra Photo Challenge.
So that we're holding this through the entire month of May. This is your last chance to submit a photo for the May Guerra Photo Challenge.
Got a couple days.
Got a couple more days, and you better post a photo that's featuring yourself with this taken this year with the hashtag Guerra Challenge, and tag our Instagram account, which is at AZBreasts, for a chance to win, not now this month, a $100 gift card, but a $200 gift card to Sephora.
Yeah, and make sure it's not private so that everyone can see it, and we can count you in.
Yes.
All right. Also, you had another great hit on the blogs. This time it was on nutritional optimization,
Which is a similar what we talked about on one of our last podcasts. So all of these surgeries we talked about in these last two.
Look at that picture. She just loves her Juven.
Yeah,
I love my Juven too.
She looked
but-
just as happy as we were with that picture. But it really re-highlights the importance of nutritional optimization. All these surgeries we talk about, whether it's body lifts, whether it's mommy makeovers, they're extensive and they require nutritional optimization and adequate nutritional supplementation after surgery to help you heal the best that you can possibly heal.
Right, and it's also not too late to get in on the summertime to sizzle. It is. The promotions are up. They're still on our website. Check out those promotions so you can save some money on your favorite procedures, the procedure maybe you've been even thinking about for years and years, saving
so
up
check
money
it out.
for. Any plans? You get any plans for June? You traveling anywhere?
June's going to be a little bit of a slower month for traveling because it's a busy month for us here. It's the busy season's the summer. Yeah. It's picking up, and we don't want to waste any time here. So maybe some small weekend trips here and there. Nothing too big, though.
Right, just a weekend.
Exactly. What about you?
So Dr. Ogley's right. Every single week in the next 4 weeks, we have surgery just about every day, both of us. And it's just, it's that hot summertime. So, I think the good people who came in late April, early May got into the June dates. Anybody else is going to probably be looking at August, but give us a call. We'll try to work really hard to get you in. So far, we've moved some post-op, moved some consults to make a little extra time in the OR, but we got our OR busy and running, and it's running pretty fast. So we're really happy about that, but you go into surgery really excited and you leave really tired. That's the only problem in it.
It's the truth.
It doesn't leave a lot of time to enjoy the weekend, but we try.
But we try the best we can.
Well, anyways, I want to thank the audience. You're always so great. Our patients are so great. We love you guys out there. Want to make sure you're safe this weekend, and don't forget to, get on that website, get on our Instagram at AZBreast, ScottOgley.com, and at Dr. Aldo Guerra, so that we, Scott Ogley, MD.
ScottOgley.com, that's coming, I'm sure.
He's not a company yet. And at Dr. Aldo Guerra on Instagram to catch our latest. We're putting a lot more in our story these days. You can see a ton of surgery and before and after photos that are going to wow you. So thanks again. Have a cool summer. We'll see you in about a week or so.
Thank you, everybody. Have a good one.
Who likes it?